Today's topic, back of thigh or posterior compartment of thigh. In Latin, back of thigh is also known as ham. So they are group of muscles together. They are known as hamstring muscle. Okay, except one muscle, that is short head of biceps femoris. All the muscles together of the back of thigh, they are known as hamstring muscles because they have certain characteristics in common. So objectives of today's class. So at the end of my class, today's topic is back of thigh. You must be able to. So I think last objective was not fulfilled because most of you cannot elaborate the names only of the front of thigh. So today's objective is that you should be able to describe, demonstrate, enumerate the groups, hamstring group muscles, their attachment, action and nerve supply. At the end of the lecture, you must be able to describe the origin, course, relations, branches, tributaries, terminations of important nerves and vessels. So before starting any topic, we discuss certain landmarks because आप muscles के origin insertion पढ़ेंगे. तो जो नाम हम बोलते हैं वो आपको पता भी होना चाहिए कि वो कहाँ present है. So in the last class also we discussed that there are three parts. There is bony fusion of ilium, ischium and pubis that forms the hip bone. So here this lower part here, this lateral part is ischium part, okay, and the part which is denoted by the numbers 1, 2, 3, 4 is ischial tuberosity. There will be another diagram that you have to draw. This ischial tuberosity is divided by a horizontal or a oblique line into upper and the lower quadrant, okay, upper and the lower half. Again, each of the half is divided into medial and the lateral part. So this upper lateral part here, it forms the superolateral part of ischial tuberosity. This lower medial part forms the inferomedial part of the ischial tuberosity. Then we have inferolateral part of ischial tuberosity. This is the conjoint ramus and this is the ramus of ischium and this is the ramus of pubis. Back of or posterior part of the femur, we had discussed that there is a ridge running over here which is known as linea aspera. Over here we have a roughened part laterally. This is gluteal tuberosity. This is the lower end of the femur. We have medial and the lateral condyle. Then over here on the sixth part, this denotes the popliteal fossa or the popliteal groove. Okay, just above there is a groove for the gastrocnemius. Then there is epicondyle, lateral and the medial epicondyle of the femur. Okay, these are the two condyle. On the lateral side we have this popliteal groove for the gastrocnemius muscle. Then we have two epicondyles. Over here we have medial and the lateral epi. जिस तरफ head है उस तरफ अपना medial condyle हो गया. So we have medial and the lateral condyle. Just above this medial condyle there is a tubercle over here which is known as adductor tubercle. ये आगे आएगा हमारे, ठीक है. तो adductor tubercle कौन से साइड पे है? medial साइड पे. Then upper part of the tibia and fibula. Posteriorly on the medial condyle, okay, on the posterior surface of the medial condyle, we have a groove over here. Now this is the head of the femur. Come in. Yes, this is the head of the femur and here there is an extension of the upper end of the femur. This is styloid process of the femur. Lower end, I told you that day that there is medial and lateral malleolus. Medial malleolus is the extension of the subcutaneous part of the tibia. Lateral malleolus is the part of fibula. Now content of back of thigh, what we are going to study, hamstring group of muscles which include ischium, head of adductor magnus. Adductor magnus you have also studied in the adductor compartment. So there are two parts of adductor magnus, adductor and ischial. So adductor part forms the medial compartment and this ischial part is included in the hamstring muscles. Semitendinosus, because the insertion is tendon-like, so this muscle is known as semitendinosus. Semimembranosus, its origin is membranous-like, semimembranosus. and long head of biceps femoris. Together, these are known as hamstring muscles. They help in walking and running. Short head of biceps femoris, sciatic nerve, posterior cutaneous nerve of thigh, and vessels. So कोई भी हम start करते हैं topic, so we study the cutaneous supply. Here cutaneous supply basically is coming from the posterior cutaneous nerve of thigh with the root value of S1, S2, S3. It is derived from the sacral plexus. So ये green color में जो दिख रहा है on the left side, this is a posterior view of the thigh, and most of the posterior part is supplied by the posterior cutaneous nerve of thigh. Then a lateral part is supplied by the posterior branch of lateral cutaneous nerve of thigh, which is coming directly from the lumbar plexus. And on the medial side, the red color that you are seeing, this is the branch coming from the obturator nerve, and in the lower part, medial side, this is coming from the medial cutaneous nerve of thigh. So cutaneous supply on the back of thigh is derived from posterior cutaneous nerve of thigh, lateral cutaneous nerve of thigh, medial cutaneous nerve of thigh, and cutaneous branch coming from the obturator nerve. So what are the hamstring muscles? You should know the name: semitendinosus, semimembranosus, long head of biceps femoris, and ischial head of adductor magnus. Now, what are the common properties of these hamstring muscles? All these muscles, they have a common origin. They are originating from ischial tuberosity. Then they have insertion on one of the bones of the leg, either on the tibia or on fibula. Okay, so they will take insertion on the tibia or fibula. Then all of them are supplied by the tibial part of the sciatic nerve. They are supplied by the medial part of the sciatic nerve, and their action: they flex the knee joint and extends the hip joint. As they are present on the back of thigh, okay, muscles on the anterior side, they had an action of, what did I explain at that time? They cause extension of the knee joint because they are extensor compartment muscles. Here what they will do? They will flex the knee joint. So they are flexors of thigh, or flexors of the knee joint, and extensors of hip joint. Okay. So these are the common properties of hamstring muscles. That is why they are included in one group. If somebody asks you why they are included in one group, because they originate from ischial tuberosity, get inserted on tibia or fibula, supplied by the tibial part of the sciatic nerve, and they have common action: extends the hip joint and flexes the knee joint. Now this you have to draw. This is the part of the ischial tuberosity. दिखाया था सबसे पहले corner में ischial tuberosity. Now this ischial tuberosity is divided into upper and the lower half by a horizontal line. Okay. Then again upper part is divided by an oblique line into upper lateral part, which is the superolateral. Upper means superior, superior means upper, and the lateral. So superolateral. Then the lower medial part is inferomedial part. Okay, so you have to draw it. Where is your register? Draw this diagram. Then lower half is divided by a vertical ridge into a lateral and the medial part. So this inferior lateral part is the part from where ischial head of adductor magnus takes origin. The medial part is covered by the fibrofatty tissues, and it comes in contact when person is sitting. Okay. Then inferolateral part, it gives origin to, you have to write it down also, long head of biceps femoris and semitendinosus. And superolateral part is giving origin to semimembranosus. Sometimes in spotting, what we do, we put hip bone and we draw, or we kind of indicate these areas with the help of the chalk, and you have to identify the area, and you have also mentioned which muscle is taking origin from which part. So that is why this is important. So you have to write it down. You can remember it again. Writing also makes you remember the name, because most of you are not grabbing the names, because anatomy is only difficult because it has different types of tough terminologies. So once you write it down, it creates a habit. Okay? So once we have drawn, now we understood the origin of the hamstring muscles. Superolateral part of ischial tuberosity gives origin to semimembranosus. Inferolateral part of the ischial tuberosity gives origin to long head of biceps and semitendinosus. Inferolateral part of ischial tuberosity gives origin to ischial part of the adductor magnus muscle. So one by one we are going to discuss origin, insertion, action and nerve supply of all these muscles. Adductor magnus, it has two part, adductor part and the ischial part. Adductor part ka origin you have studied in the medial compartment. So from where does it takes origin? Adductor part from the hip bone, from the conjoint ramus. यहाँ पे जो ये ramus है, एक तो ischial ramus से लेके conjoint ramus of the hip bone, it takes origin. Then it get inserted over here, from extending from the medial margin of gluteal tuberosity, linea aspera and medial supracondylar ridge. So this attachment, what does it indicate? It indicates insertion of adductor part of adductor magnus muscle, okay, which is getting inserted over the linea aspera, okay. Then ischial part, which is the part of the hamstring muscles, this is taking origin from the inferolateral part of ischial tuberosity, then forms the fleshy belly and then it gets inserted over here, just above the medial condyle of the femur on the adductor tubercle. Adductor tubercle is actually, it indicates the epiphyseal line of the lower end with the shaft. Okay, union of the epiphysis of lower end with the diaphysis. So adductor tubercle gives attachment to the ischial part of the adductor magnus. So there is opening over here which is known as adductor hiatus. Femoral vessel, femoral artery. Okay, it enters through adductor hiatus. It runs in the apex in the adductor canal. Then it enters into adductor hiatus. And in the back of thigh over here it forms, it continues as popliteal artery. Okay, so this opening is adductor hiatus. So this is the attachment of adductor magnus. It has two parts, adductor part and the ischial part. Adductor part taking origin from the conjoint rami and getting inserted over the medial margin of gluteal tuberosity, linea aspera and supracondylar ridge. And ischial head taking origin from the inferolateral part, getting inserted over the adductor tubercle. Now what is the nerve supply? Adductor part is supplied by, ये एक है ना ब्रॉड में याद करके रखा करो, तो इंडिविजुअल याद करने की जरूरत नहीं है. इंटीरियर कंपार्टमेंट ऑफ थाई की जो नर्व है क्या है? फिमोरल नर्व. मीडियल कंपार्टमेंट ऑफ थाई की नर्व क्या है? ऑब्ट्यूरेटर नर्व. तो अडक्टर पार्ट कौन से पार्ट में है? मीडियल कंपार्टमेंट में. तो इसकी नर्व सप्लाई क्या रहेगी? ऑब्ट्यूरेटर, पोस्टीरियर डिवीजन ऑफ ऑब्ट्यूरेटर नर्व. ठीक है. देन इशियल पार्ट, क्योंकि ये हैमस्ट्रिंग का पार्ट है और हैमस्ट्रिंग का पार्ट किससे सप्लाई हो रहा है? sciatic. Sciatic may be tibial fibers. So tibial fibers of sciatic nerve supplies the ischial part of adductor magnus. Now what about the action? We have already discussed. It will cause extension of the hip joint and flexion of the, and adductor का काम तो आपको पता ही है क्या करेगा adductor? Adduction, adductor of thigh, semimembranosus. Semimembranosus is taking origin from, you can see the diagram and tell, it takes origin from superolateral part of ischial tuberosity, forms a fleshy belly, then goes downwards and get inserted over the posterior surface of medial condyle of tibia in a groove which is present over here. ठीक है, पहले दिखाया था लैंडमार्क में. There is a groove just posterior on the posterior side of medial condyle of tibia. So this takes origin from the superior lateral part of the hip bone, get inserted in a groove on the posterior surface of the medial condyle of tibia. Okay. Now, what will be the nerve supply? Tibial part of sciatic nerve. What will be the action? Flexion of knee joint, extension of hip joint. In addition to that, when a leg, this knee joint is flexed, it also causes medial rotation of the knee joint. ठीक है? Clear सबको? So this picture is showing superior lateral part of the ischial tuberosity and a groove on the posterior surface of the tibia over here. Tibia के posterior surface of condyle, on the medial condyle. Now this is important from MCQ point of view. Oblique popliteal ligament. So oblique popliteal ligament is an extension of this muscle only, semimembranosus muscle. It extends from intercondylar fossa of the femur and till the medial condyle of the tibia, and it also forms the posterior surface of the this popliteal fossa, floor of the popliteal fossa, oblique popliteal ligament. So sometimes question may be asked that this oblique popliteal ligament is derived from which muscle? The answer is semimembranosus. इसका extension रहता है intercondylar fossa से medial condyle of tibia तक. Next is semitendinosus muscle. Origin is from, you can look at the diagram, inferomedial part of the ischial tuberosity along with the long head of biceps femoris. Its insertion is tendon-like, that is why it is known as semitendinosus. ठीक है? It gets inserted on the upper medial surface of the tibia along with the two muscles, sartorius gracialis के पीछे ये insert होता है semitendinosus. So you have to remember with the mnemonic SGS. ठीक है, उस दिन भी बताया था, सबसे आगे sartorius रहेगा, बीच में gracialis रहेगा and posteriorly semitendinosus. कहाँ की बात हो रही है? ये टीबिया के अपर मीडियल सरफेस पे. ठीक है, जिसमें कि सार्टोरियस का जो इंसर्शन है वो जे शेप, हॉकी शेप है. जे को उल्टा कर दो, हॉकी शेप इंसर्शन रहता है सार्टोरियस का ऑन द अपर मीडियल सरफेस. व्हाट विल बी द नर्व सप्लाई? टीबियल पार्ट ऑफ sciatic nerve. What will be the action? Flexion of knee joint, extension of hip joint and medial rotation of when the knee is flexed, medial rotation of the knee. So here in this picture you can see insertion of these three muscles on the upper medial surface of the tibia. In front there is sartorius, then we have gracialis and then we have semitendinosus. Insertion of sartorius is hockey shape. Next is biceps femoris. There are two heads of biceps femoris, long head and short head. Long head is included in the hamstring, short head is not included in hamstring. Why? Why it is not included? Because first of all it takes origin from the femur, not from the hip bone, short head. And it is supplied by the peroneal part of the sciatic nerve and not by the tibial part of the sciatic nerve. So origin of the long head, you all know now, that takes origin from the inferomedial part of ischial tuberosity. Okay, origin of the short head from the linea aspera. It takes origin from the linea aspera and lateral supracondyle. So a little bit lateral side पे इसका origin रहता है linea aspera पे, and then it extends, origin extend होता है lateral supracondylar ridge तक. ठीक है? So it takes origin from the linea aspera and lateral supracondylar ridge, short head of biceps femoris. Then both the heads meet in the lower 1/3 part and then get inserted on the head of the femur. Head of the fibula. Okay. So I think this is the only muscle that is taking insertion on the fibula. बाकी सबका insertion कहाँ हो रहा था? Tibia पे. और इसका इंसर्शन हो रहा है फिबुला पे, अडक्टर मैग्नस का इंसर्शन हो रहा है फीमर पे, ठीक है। तो शॉर्ट हेड का ध्यान रखना है, लॉन्ग हेड का तो आपको पता ही है कि लॉन्ग हेड जो है वो इंफीरो मीडियल पार्ट ऑफ फेशियल ट्यूबरोटी से लेगा, और शॉर्ट हेड विल टेक ओरिजिन फ्रॉम द लीनिया एस्पेरा एंड लेटरल सुप्राकॉन्डाइलर रिज ऑफ द फीमर, एंड इन दोनों का जो है दे विल मीट इन द लोअर 1/3 पार्ट एंड गेट इंसर्टेड ऑन द हेड ऑफ द फीमर, ठीक है। व्हाट विल बी द एक्शन ऑफ दिस बाइसेप्स फेमोरिस? Extension of the hip joint and flexion of the knee joint, and it will cause lateral rotation of the knee joint. उन दोनों का सेमी मेम्ब्रेन और सेमी टेंडिनोसिस का क्या था? मीडियल रोटेशन। एंड अगर हमें ये कैडेवर पे लोकेट करना हो तो सेमी टेंडिनोसिस थोड़ा मतलब सेमी मेम्ब्रेनोसिस सेमी टेंडिनोसिस जो है दे विल बी ऑन द मीडियल साइड, बाइसेप्स फेमोरिस विल बी ऑन द लैटरल साइड। एंड अगर हमें आइडेंटिफाई करना है सेमी टेंडिनोसिस एंड सेमी मेम्ब्रेनोसिस, सेमी टेंडिनोसिस विल बी लिटिल टेंडन लाइक एंड थोड़ा सुपरफिशियल रहेगा, सेमी मेम्ब्रेनोसिस विल बी डीपर टू द सेमी टेंडिनोसिस, ठीक है। एंड इनके साथ में डीपर अडक्टर हाइटिस अडक्टर मैग्नस का जो पार्ट है इट इज डीपर टू दीज मसल्स, ठीक है। यू हैव टू रिफ्लेक्ट दिस मसल्स टू सी द ischial पार्ट ऑफ द अडक्टर मैग्नस मसल। इतना क्लियर हो गया सबको? So we have discussed all the muscles of the back of thigh. समझ में आ गया सबको? पूछूं मैं? चलो लास्ट में पूछूंगी मैं अभी। So next is sciatic, longest thickest nerve in the body, sciatic nerve. Anterior compartment of thigh is supplied by femoral nerve. Medial compartment is supplied by the obturator nerve. Posterior compartment sciatic. Thickest nerve. This question was asked in PUC of the previous batch. ठीक है, sciatic nerve. So any nerve that you have to, write in your exam, you have to include all the headings covering the origin, ठीक है, root value, then relations, course, then their branches, that is distribution, and then one or two clinical you have to include, ठीक है। If you write in headings and you underline, then it is easier to us to predict that you have written everything. So all the answers in your अभी आपका एग्जाम होगा फर्स्ट PCT, ठीक है। So make sure that you write in headings. एक ऐसे के जैसे नहीं लिखना है, अगर आप पॉइंट्स में हेडिंग्स में लिखते हैं तो उसमें ज्यादा नंबर मिलते हैं। So for sciatic nerve, first what is the origin? Origin क्या है इसका? It is taking origin from the, see it is the largest branch of the sacral plexus, arising from the anterior primary rami of L4, L5, S1, S2 and S3. Now it has two components, tibial and peroneal component. Okay, so this tibial component is taking origin from the anterior division. Yes, anterior division of the anterior primary rami from L4 to S3. So the root value of tibial nerve will be L4 to S3, and common peroneal is taking origin from the posterior division from L4 to S2. So the root value will be L4 to S2. Root value of sciatic will be L4 to S3. Root value of tibial nerve will be L4 to S3, and root value of common peroneal will be L4 to S2. Common peroneal and tibial nerve both are the terminal branches of the sciatic nerve. So this is the origin of sciatic nerve. Now it will take course from the pelvic, then the gluteal region, then in the thigh. So in the pelvis, what is the relation of this nerve? It lies below piriformis muscle. Are you able to see piriformis muscle here in the diagram? So in the pelvis, it lies below the fascia of the piriformis muscle. It enters in the gluteal region by passing through greater sciatic foramina. Then in the gluteal region, it lies under cover gluteus maximus. Yesterday only there was class of the gluteal region. Every muscle over here, small muscles, vessels, nerves are present below gluteus maximus. So you have to cut gluteus maximal or reflect it to see all the structures present in the gluteal region. So here in the gluteal region, it lies below the gluteus maximus. It passes downwards in the middle over the certain structures which are together known as sciatic band, जो इसके inferior relations या anterior, because अगर हम ऐसे देखें anatomic position में, all these structures lies anterior to the sciatic nerve. So what are the structures that are forming sciatic band? The structures that are forming sciatic band are obturator internus along with the two gemelli, gemellus या superior gemelli and inferior gemelli. ठीक है, these three muscles they take insertion over in the trochanteric fossa. ये साथ में ही रहती हैं. जेमिला का मतलब ही, जेमिनिक का मतलब क्या होता है? ट्विंस, आई थिंक. ये दोनों मसल सुपीरियर इंफीरियर जेमिलस साथ में रहती है और बीच में इनके रहता है ऑब्ट्यूरेटर इंटरनस. Then the next muscle is quadratus femoris and adductor magnus. All these forms sciatic band along with the ischium part of the hip bone. ठीक है? So these are the deeper relation or the anterior relation of the sciatic nerve. So what are the structures that are forming sciatic band? Obturator internus along with the two gemelli, then quadratus femoris, adductor magnus also, and obturator externus also forms the sciatic band. Then this will goes downward. As it goes downwards, inferior gluteal nerve and artery lies in medial to this. Okay? So inferior gluteal nerve and vessels forms the medial relation of sciatic nerve. So as it runs downwards in the thigh, it is crossed by the long head of biceps femoris. It is crossed by the long head of the biceps femoris. Then it runs downwards, and here at the superior angle of popliteal fossa, the sciatic nerve divides into two terminal branches, tibial nerve and common peroneal nerve. ठीक है, तो इसका कोर्स कहाँ से कहाँ तक है? pelvis से लेके gluteal region से होते हुए thigh में it will be crossed by the long head of biceps femoris until the upper angle of the popliteal fossa. Here it will divide into its terminal branches, tibial and the peroneal, common peroneal. Clear? So exam में if question is asked, you can draw this because this will be a little difficult. So every ये आपकी उसमें भी दिया है medial nerve, radial nerve. So ये वाले diagram जो हैं, इससे आप क्या branches भी याद कर सकते हैं, course भी याद कर सकते हैं, relations भी. Okay. So what are the branches? Green color is indicating the tibial part and a little lighter grayish color is indicating common peroneal part of sciatic nerve. So in the thigh region they are together with each other. Medial side के जो fiber हैं वो tibial part indicate करते हैं, lateral side के fibers this peroneal part indicate करते हैं. ठीक है? So all the hamstring muscles that we have discussed, they will be supplied by the tibial part. Semitendinosus, semimembranosus, ischial part of adductor magnus, and long head of biceps femoris. So these are the motor branches to these muscles, except the short head of biceps femoris, which will be supplied by the peroneal part of the sciatic nerve, and then it will divide into terminal branches. So ये हो गई अपनी इसमें सारी muscular branch. It also give one articular branch to the hip joint. It will also give articular branch to the hip joint. समझ में आ गया इतना सबको? क्लियर? बाकी का कोर्स जो है टीबियल का और कॉमन पेरोनियल का फिर हम किस में पढ़ेंगे? हाँ, लेग में. ठीक है? Now arteries on the back of thigh. Femoral artery जो है जैसे ही enter होती है thigh में below the inguinal ligament, it gives one branch, important large branch, which is profunda femoris, है ना? Again profunda femoris, so it will divide into circumflex, medial and the lateral circumflex branches, and then this will continue and divide into 4 perforating branches. So on the back of thigh, the main arterial supplies from the perforating branches of the profunda femoris, medial and the lateral circumflex branches of the profunda femoris. Okay? Have you studied this? Medial circumflex then divides into acetabular, transverse, no? Ascending and transverse and acetabular branches. Lateral circumflex femoral artery again divides into ascending, descending and transverse branches. So main supply of the back of thigh is coming from the branches of profunda femoris. This diagram is important. From this diagram, all the anastomosis is clear on the back of thigh. Okay, and just a little above, in near the trochanteric fossa, there is an anastomosis which is known as trochanteric anastomosis. Below, near to the lesser trochanter, ट्रोकैंट्रिक फोसा का एग्जैक्ट लोकेशन क्या है? हमने ग्रेटर ट्रोकैंटर देखा था. ग्रेटर ट्रोकैंटर के जस्ट अंदर की तरफ एक फोसा रहता है, दैट इज नोन एज ट्रोकैंट्रिक फोसा. ठीक है. देन ग्रेटर ट्रोकैंटर थोड़ा ऊपर सुपीरियरली रहता है, नीचे की तरफ अपने रहता है लेसर ट्रोकैंटर. लेसर ट्रोकैंटर के अराउंड एक एनास्टोमोसिस रहता है विच इज क्रूशिएट एनास्टोमोसिस. देन देयर इज अ लॉन्गिट्यूडनल एनास्टोमोसिस हैपनिंग ओवर हियर. ओके, so over here trochanteric anastomosis is taking place between descending branch of superior gluteal artery, inferior gluteal artery, ascending branch of lateral circumflex femoral artery and medial circumflex femoral artery. Okay, so ascending branch of medial and lateral circumflex femoral artery and descending branch of superior gluteal and inferior gluteal artery over here forms the trochanteric anastomosis. Cruciate anastomosis is happening between the medial के transverse branches of medial lateral circumflex femoral artery and also branches coming from the inferior gluteal and superior gluteal artery. Then deep down also there is one important artery also over here. First perforating artery gives an ascending branch and participate in the cruciate anastomosis. Then these perforating branches, they anastomose with each other with their ascending. ऊपर की तरफ जा रहा है तो ascending, नीचे की तरफ दे रहा है तो descending. So they are anastomosing with each other with their ascending and descending branches. And this anastomosis is a longitudinal anastomosis. And then this fourth perforating artery, and there is a branch coming from the popliteal artery, superior muscular branch, which anastomose with each other. So these anastomosis provide an alternate pathway for the blood supply on the back of thigh. Okay, समझ में आया है इतना? You have to draw this diagram so that it will be clear to all of you. First, draw this major vessel. ऊपर की तरफ यहाँ पे अपने कौन सा है ये? Common iliac. Common iliac कहाँ से आ रहा है? तो थोड़ा सा और ऊपर जाते हैं. सी बॉडी को जो ब्लड सप्लाई है, ऑक्सीजनेटेड ब्लड कहाँ से आ रहा है? एओर्टा, असेंडिंग aorta, then it will turn around form arch of aorta. Arch of aorta will give three important branches: brachiocephalic, left subclavian and right brachiocephalic, left subclavian and left common carotid. ठीक है, तो ये सारी ब्रांचेस अपर लिम्ब, हेड एंड नेक को सप्लाई कर रही हैं. आर्च ऑफ एओर्टा देन टर्न्स डाउनवर्ड इन द thorax, it forms thoracic aorta. It pierces the diaphragm, then it forms abdominal aorta. Abdominal aorta then it terminates into right and left common iliac. ठीक है, so common iliac is coming from the terminal part of abdominal aorta. Now this common iliac again it will divide into external iliac and internal iliac. Internal iliac will go and supply the pelvic perineum region, and then external iliac below the inguinal ligament, then it will continue as femoral artery for the lower limb. So main blood supply is carried through the femoral artery. Okay, external iliac will continue as femoral artery below the inguinal ligament. Then it enters the thigh. In the thigh, just below the inguinal ligament, near about 2.5 centimeter, it will give profunda femoris. Now this profunda femoris divides into medial circumflex, lateral circumflex and perforating branches. They are given in the anterior part, then they pierces the epidurosis attached के अभी इतना नहीं है, बस ये क्या करेगा, then it will turn around, enters into posterior compartment all these branches of profunda femoris, then they will enter into posterior compartment, and then they anastomose with gluteal vessels. When they anastomose at the trochanteric fossa, it is trochanteric anastomosis. Near the lesser trochanter, it is cruciate anastomosis. This is the longitudinal anastomosis. Here, there is participation of inferior gluteal artery, not superior gluteal artery. Here in the this cruciate anastomosis, there is anastomosis between this descending branch of inferior gluteal artery, transverse branch of medial circumflex and lateral circumflex artery, and ascending branch of the first perforating artery of profunda femoris. क्रूशिएट और ट्रोकैंटिक एनास्टोमोसिस जो है वो एग्जाम में पूछा जा सकता है, एमसीक्यू में भी पूछा जा सकता है, ठीक है। बाकी लॉन्गिट्यूडनल एनास्टोमोसिस इतना आता नहीं है। मे बी इन एमसीक्यू इट मे बी आस्क्ड दैट लास्ट परफोरेटिंग आर्टरी व्हिच इज द कंटिन्यूएशन ऑफ perfunda femoris only terminal part, it anastomosis with superior muscular branch of popliteal artery. लॉन्ग क्वेश्चन जो है वो इसमें नहीं आता है, बट इस डायग्राम से आपको पूरा एनास्टोमोसिस क्लियर हो जाता है। नेक्स्ट क्लिनिकल इंटीग्रेशन। जैसे हमने देखा था एंटीरियर में, वी आस्क द पेशेंट टू एक्सटेंड द नी अगेंस्ट रेजिस्टेंस। हियर वी विल आस्क द पेशेंट टू flex the knee against the resistance so that we can feel the contraction at the back of thigh, contraction of the hamstring muscles. An intramuscular injection in the gluteal region, it is given in the upper outer quadrant because to prevent the injury to the sciatic nerve. Sciatic nerve block, अगर कोई सर्जरी परफॉर्म करना है द बैक ऑफ थाई, तो ऑब्वियसली बिकॉज हमने सारी मसल्स, नॉट ओनली बैक ऑफ थाई, क्योंकि अगर हम ऊपर ही इसको ब्लॉक कर देंगे तो लेग में भी ब्रांचेस sciatic नर्व की ही जा रही है, तो सब वहां पे एनाल्जेसिया एनेस्थेटिक हो जाएगा, ठीक है। सो फॉर दिस nerve block should be given 4 to 5 centimeter midway between a line joining posterior superior iliac spine and greater trochanter. स्लिपिंग फुट, पैर सो गया मेरा। क्यों होता है स्लिपिंग फुट? क्योंकि कुछ पार्ट के लिए जब फोर्स लेती है sciatic nerve, which is running between these adductor magnus and quadratus femoris muscle, at some point it is in direct contact with the femur. So it may get compressed if you sit on the edge, और आपका सिटिंग पोजीशन ऐसा कुछ है, so that will compress the sciatic nerve. So for some time it will cause numbness once you stand up, है ना, एक झंझनाहट सी फील होती है, numbness फील होती है, that is because of the compression of the sciatic nerve, and after some time it goes away. So that condition is known as slipping foot, compression of the sciatic nerve against the femur in the sitting position causes numbness along its distribution. If there is an injury to the sciatic nerve, so there is cutaneous, there is loss of cutaneous supply over this region, that is back of the leg and a little bit area lateral to the leg. Now, there is sharp shooting pain along the distribution of the sciatic nerve extending from the gluteal region in the leg and also in the dorsum of the foot. There is sharp shooting pain that may be because of the herniation of the disc, which is related to the sciatic nerve L4 L5 का अगर disc का herniation होता है, that will compress the spinal nerve, so that will cause the sharp shooting pain along the distribution of sciatic nerve. This condition is known as sciatica. This condition is known as sciatica. There is a sharp, excruciating pain along the distribution of sciatic nerve. One of the causes is herniation of the disc, and another cause may be piriformis syndrome. Yesterday you may have studied piriformis. There is compression of this nerve because of the piriformis muscle. So this is all about today's